Hello viewers, welcome to the program Depression, the Common Cold of Modern Life. Friends, we all want a happy life, we all want a meaningful life, and we want that our life is free from pressures, anxieties and worries. However, the modern day life today has its own expectations, demands and pressures from us, which creates an impact on our body as well as mind. And this leads to many health related problems also, related to physical health problems, mental health problems, stress, depression and other so many problems. In order to create awareness about the importance of mental health, the World Health Organization WHO observes 10th of October every year as the World Mental Health Day. As part of this Mental Health Day, the Discipline of Psychology IGNOU has organized this talk today on depression, the common cold of modern life. The objective of this Mental Health Day is to spread awareness and understanding about the mental health and promotion of mental health. We will have a talk on this particular topic, depression, the common cold of modern life, from our esteemed speaker, Dr. Jayanti Datta. Dr. Jayanti Datta is a renowned consultant clinical psychologist. She is an accomplished academician and worked as a professor in Delhi University. So welcome Dr. Datta for the talk today on depression, the common cold of modern life.
Individual differences persist in the same family. A brother is able to take it, another brother is not able to take it. So there is an individual variation for tolerance of frustration and conflict. When you are not able to tolerate it any further, it is likely to cause a psychological breakdown. Psychological breakdown can give rise to any kind of psychological illnesses. If it is depression, then as I told you, your sleep pattern will be affected, your social networking will be affected, your appetite will be affected, and there will be a tendency to get into your own cocoon and say that, well, there isn't any tomorrow in my life. I don't want to wait and stay alive for tomorrow. Sometimes I've seen patients who are having some other physical problems like hypothyroidism or are having certain chronic physical ailments also can slip into depression. This is primarily because they have a low willpower, low support system, and there isn't anybody around to give that, emotional consolation. Patient is on medication, patient needs medication. Very often I've seen even in major hospitals, in cardiovascular cases, the patient has gone through cardiac interventions and feels now my heart transplant is over. I don't think I'm going to survive. Patient starts refusing food, and this is happening in most of the major hospitals. So there again, this is just a transitory phase. Psychotherapy really works. Now if I come down to the treatment, you have to keep always in mind, as I said, the background, the onset and the age of the patient. And what are the major symptoms? If the patient is suicidal, I would warn you not to take the risk. Seek a psychiatric opinion also, right? And then start with your psychotherapy. To my amazement, I have seen cases where the patient has attempted suicide and somehow the patient has been brought to me, and this usually these kind of things I see very often with the youngsters, And this particular girl I'm talking about, she was a second year student. She had attempted suicide twice. One of the parents is a doctor, MBBS doctor. And he felt, well, let me see, kuch nahi to dekh lete hain. It might help. So when they brought her to me, almost 2 sessions I had to consume only asking her about whereabouts. The rapport formation is very important. And 3rd day she started opening. Now the psychodynamic behind depression is the patient bolts, There is a lock and key kind of a system operating within the psyche of the individual. I will not tell this to anybody. There isn't anybody to listen to it. Nobody will understand me. This kind of mind setup gives a compounding impact. So you stop sharing. And this is what happened to this girl. And then it started pushing her towards risk zones, In her personal life, she traded into a couple of areas where there was high risk. And that induced guilt feeling. And this is how it gets into the manifestation of symptoms of depression. You are not able to share, you have a deep sense of insecurity, and you have a deep sense of isolation. And then it gives rise to the features of depression. Now, when you talk about treatment, as I said, if it is a depressive stupor or extreme case of depression, then of course you need medicinal interventions. Unfortunately, as I said, the taboo, if you say that you are going to a psychiatrist, you're going to a psychologist, people will say, are you mad? Let me tell you, friends, if you have a healthy body and you have some ailments, you don't hesitate to go to a doctor. If you have a healthy mind, you certainly can have problems with the mind of yours, and there is no harm in seeking a professional help in that. Right? So you should not hesitate. And whenever you see somebody is having this kind of features, please help the person to go and reach the professionals. Long-term psychotherapy certainly can take you out. One of the very preferred techniques in the field of psychotherapy is CBT, cognitive behavior therapy. And people say, all right, you only talk. Mind you, friends, I had to spend 10 years learning how to talk. You will see your primary needs, your food, your water, your sleep, your rest, everything can get affected by this talk. When you are posted at a particular place, you are enjoying your dinner, and somebody comes and tells you your posting has been changed, you've been posted to this particular place. What happens to your desire for food? When you hear something which is not really very amicable kind of a news, immediately it affects your primary needs. You are not able to sleep, you are not able to eat or enjoy your food. What I'm trying to put across is talking also is a scientific method. We work out, we decide what all I'm going to talk to my patient about, how much intervention. Sometimes I don't talk at all. I allow the patient to talk, because whatever he speaks are all coming from within the 3 layers of mind. You cannot reach subconscious and unconscious by any other means. There isn't any radiological interventions. All you have to do is let the patient ventilate. Believe me, with the right opportune time, with the right technique of psychotherapy, as I said, cognitive behavior therapy is very effective in particularly treating depression. If you are able to handle your patient all right, you can reach the immune system of the patient. All suicidal cases which I have handled till now, mostly I have never had to take any help of supportive drug therapy. Only the psychotherapy. You have to decide that how much time, what kind of psychotherapy, and how many sessions you're going to give. Yes, unlike medicinal practitioners, your patient would like to know that you are in and around, they can call you. This phase lasts only during the first few sessions of yours. Once that bonding is there, the patients, very often I get, patients who've been cured and they are happily doing their work, settled in their own life. Still, once in a while they would call up and say, "Are you in town? Are you here in India? Can we talk in case I need?" Not all of them need, but sometimes, this reassurance really works. When you tell your child, "Look, I have taught you, you must write all these things in your exam." You are not there in the examination center, but the child knows that, yes, you are there for the support. That also works miracles. Now, with this kind of hectic schedule of ours in today's era, we hardly have any networking. We hardly have any time for us. How to curb these depressive tendencies or depressive outbreaks? In a normal daily routine. You don't have to be really a patient of depression to counter the depressive outbreaks when occasionally you have it. The advice from my side would be, please monitor your daily routine, have a time management slot, work it out, and for heaven's sake, don't neglect your hobbies. You must inculcate, if you didn't have any hobby, see what you enjoyed doing in your life. Go back. In 24 hours, at least have 30 minutes for yourself. If not 30, minimum you need is 15 to 20 minutes in a daily routine for yourself. At that time, you only think about doing what you enjoy doing only for yourself. And the safest way is maintain a social network, maintain some amount of outdoor life meaning connect with the nature. If you can connect with the nature, watch the birds, watch the weather, get drenched in the rain, not now, see the season, and then accordingly do it. But when you do these kind of things, you reduce the chances of your getting into depressive illness.
Thank you, Dr. Datta, for that was such a lively and enriching talk, and highlighted on different aspects of depression. So I think we can take a few questions from the participants. I'm sure there'll be many questions in your mind. So I think we can take a few questions.
What are the chemical changes happening?
Very good. You have serotonin uptake which gets affected, your adrenaline gets affected, and your dopamine level also gets affected. Now these are the hormones and neurotransmitters which are basically altered in cases of depression, and most of the medicinal interventions are for the uptake of these scenarios. And as I said, unless occasionally if you are having these depressive outbreaks, you would not have this. But if it is severe, of course, the delinquents are serotonin and dopamine. If these levels are restored, they control your mood.
For a very, very interesting talk. I just want to know, in the case of adolescents, they are themselves going through so many life changes and, mood swings and so on. How can an alert parent be aware that this might be, tending towards depression?
Another good question. Now, you see, unfortunately, today's era where parents have also started patronizing the privacy. Very many parents come to me and say, no, but doctor, my boy needs a separate room, and invariably, the lights of his room are on. When we are about to sleep, he goes into the Facebook and he's busy with his computer and bolts his door from within. If your child insists on privacy to the extent of bolting the door from within, I would say the first warning signal. He is not going towards the right path. I tell the parents, give the privacy if the child needs it, but he should always know that my ma or my dad can walk in any time. If you find all of a sudden his psychomotor agility is heightened, another indicator the child is probably into something. If you find there is an alteration in his daily routine habits, like the time to sleep, he's changed, his food habits, he's changing, it's another warning signal. And in some pretext or the other, आज पेट खराब है, कल teacher नहीं आएगी, what will I do? Now these are the signals where the child is not really doing well at the psyche front. Another could be he's very restless and he's fretting around, he's changing his friends circle. Now these are as parents, you should take cognizance of it. I give one-liner message to all my audience who are listening to me. Try not to be a policeman with your child. Try not to be a probing and investigating parent. Try to be a friend. Try to be a person where the child, wherever he is, whatever happens, he should feel secure. If I go and tell my parent, they will understand me. That's the confidence you should be able to imbibe in your child. If you are able to do that, you are a successful parent. Even tomorrow, as an adolescent, if he gets swayed by the peer pressure, gets into something nonsense, he would come and would be the first one to tell you, can I tell you? But if you are doing policing, you will lose your child. He will tell you lies, then he will become master in that. He will cook stories. I've seen children also doing it. I'm handling a 4-year-old child. He's not a patient of depression, but he is a handful of problem for the school teachers. Parents both are engineers, very cute, very intelligent boy. Tell him anything, he will pick it up. He learned his lessons all right. He is excellent in his studies, but the problem is he will bully. He will bully everybody. He wants something, he has to be given. If his friend is having it, his classmate is having it, he wants it, he'll tell the teacher, go and get it. The teacher gives, no, you had it. Then he will get into the pranks, and in one of my sessions, he says, Doctor Auntie, इस teacher को तो मेरी मम्मा ठीक कर देगी. Now, that was a lead item. I started making the child talk, and I learned mother is a very dominant factor in the family, bullies the father, bullies everyone. So he wanted to adopt her style and had problems.
So I think it was quite nice. And we came to know about so many aspects of this particular topic. So to conclude, we can say that depression now has become a major public health challenge, and it has become very common right from starting from the school stage, and even Dr. Datta said it starts from the newborn baby also, okay, until the old age. And even an ICMR survey on urban mental health, it has reported that in Delhi around 8 to 10% of people suffer from psychiatric illnesses like depression, anxiety and schizophrenia. And even the sub-syndrome illnesses, which refer to the psychological problems that do not qualify as being mental illnesses, they are more common in the urban population. However, we still have not started taking our mental health very seriously, seeking professional help, as Dr. Jayanti had pointed out, that seeking professional help, still it is being looked at in a negative way. There are stigma and misconceptions attached to it. So, however, if we look around us, there may be many people around us in our family, in our neighborhood, in our community, in our workplace, who may be suffering from depression, and they need the psychological care and support. And how do we ensure this? By providing psychological first aid. And this psychological first aid, keeping in mind the theme of this year's Mental Health Day, will be the first step in reaching out to these people with depression. So, thank you, Dr. Jayanti Datta, for joining us today, and thank you all the participants here, and thanks one and all.